Louis's never ill, he'd never been to the doctor, he was a super healthy kid.
He really enjoyed life.
This is the story of Adrien and Louis. Both had Down syndrome, both died suddenly and unexpectedly under NHS care.
And he knew he was going to die. It was just awful.
For 9 days, Adrien was fed nothing in hospital. By the time his family realised, it was too late.
As it turns out, he was starving him.
Get on the train to all...
Louis was 17. Doctors said he wasn't seriously ill. Then he died at home, in his mother's arms.
Is there any doubt in your mind that Louis died because he had Down syndrome?
Absolutely.
Campaigners say their deaths are part of a pattern.
The government needs to do an awful lot more. These people matter.
But why are learning disabled people dying like this?
How are you feeling about today?
Really scared, genuinely quite nervous.
They have waited almost 3 years for this day. The day they discover what happened to their son Louis, whose pictures adorn every wall, his memory on mugs, and the milestones of childhood.
How old is he here, you say?
11 months.
11 months.
Yeah, really, really handsome, you know, wasn't he?
Get on the train to all the way to London.
Louis was 17. He had Down syndrome, and in January 2023 became pale and wasn't being himself. He saw several doctors at hospital and at home who didn't think he was seriously ill.
I got a panic. I said, I'm really worried about him. Actually, as I sort of to be in the hospital looking at him, all the overwhelming fear of what this could be, because actually, Louis's never ill. He'd never been to the doctor. He didn't even have COVID. He very rarely gets a cold. He'd never had a tummy bug. He was a super healthy kid.
Louis was too anxious to have a blood test, so his parents asked doctors several times to sedate him to work out what was wrong, but they refused. And 10 days after becoming unwell, Louis died at home, in his mum's arms.
Is there any doubt in your mind that Louis died because he had Down syndrome?
Absolutely. Why didn't they just do some proper checks on him and fob us off with he was fine? I mean, we listened to them, and that's my biggest regret. When you're a mum of a child with disability, everything is 20 million times harder than for anybody else. It's a constant battle, and you're just resigned for the fact, here we go again, another difficulty, another excuse.
So Jackie's latest battle is at South London Coroner's Court, where Louis' inquest is expected to last the whole day. They hope it will give some answers. Derek already has his answer, but he can't comprehend it. Every Sunday in a quiet corner of Dorset, he comes to sit with the son he adored, who died where he should have been safe.
It was one of the photographs taken at one of the...
That's Adrien.
With Adrian, full of fun. He really enjoyed life.
Yeah.
Adrien was 56 and had Down syndrome. In September 2021, he broke his hip in his care home and was admitted to hospital for an operation. He was recovering well, but inexplicably doctors wrongly assumed Adrien couldn't eat solid foods when he could, and listed him as nil by mouth. They did not feed him for 9 days.
He went on a trip. Not being medical, we just naturally thought that he's having a nutrition to feed him. As it turns out, he was starving him.
Adrien didn't die from a broken hip. He died because by the time his family realised he wasn't being fed, he was too unwell to recover.
So we were just worried, just so worried. He was just really poorly, and he did look at me and Dad, because we went back in the room on the Saturday, and he said to me, Leslie, I don't want to die. I don't want to die. And he knew he was going to die. It was just awful, you know. And we said, oh no, Age, you know, trying to comfort him. But, you know, even he knew. Yeah. Sorry, Dad.
An official NHS review found Adrien died through a lack of nutrition. But campaigners and charities fear deaths like Adrien's and Louis' are linked to a growing NHS crisis in learning disability care. They've written to the Health Secretary after a 43% decline in learning disability nurses since 2009, warning that urgent intervention is needed to avoid imminent collapse in care.
The Oliver McGowan mandatory training.
The letter was signed by Paula McGowan, who successfully campaigned for mandatory training for all health workers in treating learning disabled and autistic people.
Hello, this is day one of the 22 press-up challenge.
Her 18-year-old son Oliver died in 2016, wrongly prescribed antipsychotic drugs by NHS staff who did not understand his disability. But 3 years since the training passed into law, ITV News has found that NHS England is falling way below targets to train a third of its staff by 2025.
People with a learning disability are still dying from the same conditions and the same failures. The government needs to do an awful lot more. These people matter. And I would question why our government and our public don't see it the same way.
It's 5 p.m. back at South London Coroner's Court, and Louis's inquest has failed to conclude how he died. His official cause of death was unascertained. Louis's family have waited more than 2.5 years for today's inquest. They've just sat through 7 hours of evidence and testimony, and yet they will come out of this court without any answers. Their healthy 17-year-old son became ill suddenly and died, and they cannot accept that nothing more could have been done to save him.
All we wanted was a blood test to get a proper diagnosis. He had a disability, a Down syndrome. He was a bit of a frightened kid. He wasn't a menace, he wasn't being anything out of the ordinary. His behaviour wasn't challenging. They could have done something.
None of it makes any sense. I'm not going to be able to process this, ever. I'm so utterly and completely devastated.
Louis loved to sing. He loved Elvis, the Beatles and musicals. Adrien loved to dance and playing golf with his dad. Two families that can't make sense of how so much life could be lost with such little regard. Daniel Hewitt, ITV News.
Such little regard, and just heartbreaking.
Yeah.
What has been the response from the NHS and the government?
Well, NHS England say they are committed to rolling out this Oliver McGowan mandatory training programme. They call it one of the biggest training programmes in the NHS's history. The clue is in the word mandatory. It's meant to be rolled out across the whole of the NHS. We've discovered that in some parts of the National Health Service, just 3 or 4% of the workforce have been trained in it, when by now it should have been 30%. NHS England say they're working to improve those numbers. Though this training was brought in to avoid stories like this, and yet we still hear them all of the time. We've spoken to dozens of families who say when they go into hospital, learning disabled people, when they go into hospital, they feel invisible, that the health service does not have time for their needs. And they are not asking for a lot, Romilly. They are asking for a little bit of extra time so things can be explained to them. They are asking for their medical notes to be read properly. They are asking for their advocates, their parents often, to be listened to be consulted, to a side room, to feed them when they are hungry. 40% almost of people who died with a learning disability in 2023 died avoidably. That is double the rest of the general population. And surely, when people go to hospital, when they interact with the health service, that is when they should feel the most safe and the most secure. Yet time and time again, in the case of people with learning disabilities and autism, it is the exact opposite.